Hi, I'm Robin Blackstone, surgeon, author, and architect of Health 4.0. Welcome to Dr. AI, the podcast. This is day one of a 7-day series leading to the launch of my book, Dr. AI Reimagining Healthcare, Rebuilding Trust, Delivering Health 4.0, on April 7th. Today, the architecture of a broken system. At 1:30 in the morning, a man named Mike wakes up because his big toe is throbbing. He reaches for his phone. What happens next is something no American has ever experienced, but every American deserves. I'll tell you Mike's story later this week, but today I want to tell you why Mike's story doesn't exist yet, why the system we have was never built to deliver what Mike needed, and what we can do about it. Because this isn't a story about one man's toe. It's a story about a choice America made over 100 years ago. A choice between two visions of medicine, and we chose wrong. There are two symbols that have competed for the soul of medicine for thousands of years. The first is the rod of Asclepius, a single serpent wrapped around a staff. Asclepius was the Greek god of healing, not surgery, not intervention, healing. That staff represented the idea that health is a journey, that the work of restoring a person to wholeness takes patience, observation, and care. It's the symbol used by the World Health Organization and most medical associations around the world to this day. The second is the caduceus, two serpents around a winged staff. This staff belongs to Hermes. Now, Hermes was many things: the god of commerce, negotiation, travelers, and, let's be honest, trickery. Not exactly the guy you'd pick to represent your health system. But in 1902, that's exactly what happened. An officer of the U.S. Army Corps selected the caduceus as the symbol of military medicine. It was a mistake, a clerical mix-up, but it stuck. And over the next century, that mistake became prophecy. Because America didn't just adopt a symbol, we adopted a philosophy. Commerce, not healing. Transactions, not trajectories. A system organized around billing for sickness rather than investing in health. Now, nobody sat down and said, let's build a healthcare system designed to fail people. That's not how it happened. It happened through decades of decisions about who gets paid, how much, for what, and by whom. That gradually built an architecture. And like any architecture, it has a logic. The question is, whose logic is it serving? So let me show you how it actually works. Because most people, most patients, most voters, most of the people making decisions about their own health every day, they have no idea what's happening behind the curtain. Deep inside the machinery of American medicine is a pricing system built on something called the Relative Value Unit, or RVU. Every medical service in the country, every office visit, every procedure, every test, has an RVU value assigned to it. And those values are not neutral. They are not based on what keeps you healthy. They are based on what can be billed. The values are set by a committee called the RUC, the Relative Value Scale Update Committee. It's a group dominated by specialists who recommend to Medicare how much every service should cost. Their recommendations are accepted over 90% of the time. 90%. Without serious challenge. Now, here's what that means in practice. Say you go to your primary care doctor. You've got 15 minutes. In that 15 minutes, she's managing your diabetes, your blood pressure, your anxiety, reviewing your medications, asking about your sleep, trying to understand what's actually going on in your life. That visit earns 1.2 to 1.5 RVUs. Now, I was a surgeon. I can tell you that a laparoscopic gallbladder removal takes about 30 minutes, maybe an hour if it's a difficult case and you're stretching it. That procedure earns 20 times what that primary care visit earns. 20 times. So the system pays lavishly for the rescue, for the crash, the emergency, the intervention, and almost nothing for the quiet, persistent, deeply human work of keeping you well. The doctor who prevents your heart attack earns a fraction of the doctor who operates on you after 20 years of neglect. And I want to be clear about something. This is not a conspiracy. I'm not saying there are villains in a room somewhere. This is architecture. It's structural. And the structural was built by and for the people who benefit from it most. Now, here's what I also want to say, and I say this as a surgeon who spent decades inside this system. If you need a big rescue, there is probably nowhere better in the world to be than in the United States. If you come in with a blocked coronary artery in most American cities, that artery will be unblocked within the hour. That's a miracle. We should be proud of that. But a system that only shows up for the crash, that's not a health system. That's a rescue service. And rescue is not the same as health. There's something else this system doesn't want you to think about too carefully. Your zip code may matter more than your genetic code. I grew up in the Grand Canyon. My father was a school teacher and principal of the public school inside the Grand Canyon National Park. And even there, in one of the most beautiful places on earth, you could see the fault lines of American healthcare. Who had access, who didn't, who got seen, who got forgotten. The structural determinants of health, the written and unwritten rules that decide who gets an advantage and who doesn't, are built into laws, policies, and social norms. They control how power, money, and opportunity flow through a society. They determine whether your neighborhood has a park or a toxic waste site, whether your school has a nurse, whether your mother's job offers insurance. These are not accidents. They are decisions. City planners drew red lines around neighborhoods where loans would be denied, parks would not be built, and health services would be placed miles away. Those decisions were made decades ago. The health consequences are playing out right now. Not long ago, I spent a month on a grand jury in New York City, and I can tell you time and again, we watched video from neighborhoods where you would never go if you didn't have to. But a lot of people live there. They raise their children there, and they are not safe. Not from crime, and not from the health consequences of living in places designed to be forgotten. Your personal health culture, where you grew up, how you grew up, the forces that shaped your daily life, is as important as your biology, maybe more important. Your health is the melting pot of all these forces. And if we're going to build a system that actually keeps people healthy, we have to start there, not at the emergency room door, upstream, where life is actually happening. Later this week, I'm going to tell you about a young woman named Talia who was writing an essay at school and asked a question that led her to understand her own neighborhood in a completely different way. That story changes how you think about what health even means. So here we are, a system that pays for rescue, not prevention, a pricing machine built by specialists for specialists, a country where your address predicts your health more than your DNA, and underneath all of it, a workforce of doctors, nurses, and caregivers who went into medicine to help people and are burning out because the architecture won't let them help people. Most of the conversation about healthcare reform is about fixing the system. A new billing code here, a pilot program there, another portal layered onto a structure that's already buckling under its own weight. We keep grafting new branches onto a plant that can barely stand. But what if we stopped grafting? What if we planted something new? What if the tools of this century, artificial intelligence, blockchain, genomics, supercomputing, could power something entirely different? Not a better vision of the old system, a new operating system for health, one where you, the person, not the transaction, are at the center, where your culture, your biology, your values, and your lived experience actually define the care that you receive, where technology is a trusted companion, not a billing engine, where the financial architecture rewards keeping people well instead of waiting for them to break. I've spent decades inside this system as a surgeon, as an educator, as someone who's watched colleagues burn out and patients fall through cracks that were engineered into the foundation. And I've spent the last several years building something different, not as a final answer, but as a blueprint, tested, specific, ready for the architects who will build it with me. Over the next 7 days, I'm going to share what that looks like. This isn't theory, it's a blueprint. On April 7th, the book arrives, but the conversation starts now. Tomorrow, day 2, I'm going to introduce you to the most important word in healthcare that you've never heard: health principle. Not patient, not consumer, not member. Health principle. That single shift changes your entire relationship to the system. It changes everything. Subscribe wherever you're listening so you don't miss it. And if today's episode landed and you felt the weight of this system, share it with someone who needs to hear it. The book launches April 7th. You can find everything at robinblackstone.com. I'll see you tomorrow.